The confirmed number of new coronavirus cases reported in Los Angeles County in the last 24 hours is 896 with 17 additional deaths. Here in Torrance, 11 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Christine Lee. It's Wednesday, November 3rd. Kids ages 5 to 11 are now able to get a COVID-19 vaccine. The smaller dose of the Pfizer vaccine has been formally approved by the U.S. Centers for Disease Control and Prevention. That means 28 million children across the country, including 900,000 right here in LA County, can start getting their shots as early as today. The county's public health officials say they are well stocked. A total of nearly 300,000 doses will be delivered by the end of the week. About 900 providers county-wide are prepared to distribute the vaccines. County mobile vaccination teams will work to supplement vaccinations offered by existing providers so children can have easy access. Throughout this month, the vaccines will be offered at 480 school-based events with a focus on schools located in high-need areas. The CDC reminds parents not to give their kids a pain reliever before getting the COVID-19 vaccine. It's something that some parents may be considering in an effort to mitigate side effects. But the CDC says pain relievers prior to a shot are not recommended because it is not known how it might affect the vaccine. Instead, the agency urges parents to talk to their doctors about a non-aspirin pain reliever after the shot if needed. Recent polls found parents are very hesitant about getting their kids vaccinated. A Kaiser Family Foundation poll from October found 30% of parents of kids ages 5 to 11 will definitely not vaccinate their little ones. 5% will only do so if required, and 33% will wait and see. And a Gallup poll also conducted last month found only 55% of parents of children under the age of 12 plan to vaccinate their child. LA County public health officials provided a framework for lifting mask requirements. For outdoor mega events involving more than 10,000 people, all of the following criteria need to be met. LA County case rates must be at or below moderate transmission as defined by the CDC for 3 consecutive weeks. That means less than 50 new weekly cases per 100,000 residents, at or below 600 daily hospitalizations, a full vaccination rate of 80% or more for those ages 12 and up, and no reports of new variants of concern emerging, significantly circulating, and threatening vaccine effectiveness. These criteria must also be met for masking requirements to be lifted at indoor events or establishments involving fewer than 1,000 people. Sites including indoor offices must also have a vaccination verification process in place. All customers and employees must be fully vaccinated, and accommodations with additional requirements must be made for those with approved exemptions. Indoor masking will remain mandatory due to federal and state requirements at many locations, including public transit and federal transportation hubs, TK to 12 schools, and childcare, healthcare, and youth settings. Well, get ready to show your proof of COVID-19 vaccination when you go out to eat, drink, and play in LA. Starting November 8th, citywide mandates will require customers to show evidence of vaccination before entering a wide array of businesses, including bars, movie theaters, and shops. LA City leaders approved one of the strictest vaccine mandates in the country last month, and there are more mandates coming from the county. They start tomorrow and require mostly businesses such as bars, breweries, nightclubs, and wineries to verify full vaccination of all customers and employees before they enter indoor portions of their venues. The LA County's health order is not as restrictive as the city's new rules and do not extend to places such as fitness centers, nail salons, or shopping malls. Under the county rule, people who cannot provide proof of full vaccination should be served in outdoor portions of the facilities. They are also allowed to use a restroom, make a delivery, or pick up takeout orders while wearing a mask. A new study shows an antidepressant cuts both the risk of death from COVID-19 and the need for people with the disease to receive intensive medical care. Researchers studied almost 1,500 people in Brazil who had the coronavirus and were at high risk of severe disease. About half of them received fluvoxamine, a drug taken for conditions including depression and obsessive-compulsive disorder. The rest received a placebo. The clinical trial showed that among participants who took the drug during early stages of the disease, COVID-19 related deaths dropped by about 90%, and the need for intensive COVID-19 related medical care fell by roughly 65%. The results were published last month and was shown to be one of a handful of therapies that show strong evidence of preventing progression from mild to severe COVID-19. Researchers at Emory University School of Medicine say this treatment should be adopted for those at high risk for deterioration who are not vaccinated or cannot receive monoclonal antibodies. Other experts say while they are excited about the results, there are caveats that include not knowing how applicable this would be in a setting outside of Brazil. Meanwhile, researchers say fluvoxamine's low cost could make it accessible worldwide. A 10-day course costs only about $4, and the drug's patents have expired, meaning any company can produce it. They also say pairing fluvoxamine with another drug that interferes with viral replication, such as Merck's upcoming antiviral molnupiravir, could be even more effective. The foul odor in Carson is now a local emergency. The LA County Board of Supervisors made the formal declaration yesterday, and Supervisor Holly Mitchell called on Governor Gavin Newsom to declare a state of emergency and help address the issue that has been plaguing the city and its neighboring areas for weeks. The odor has been traced to hydrogen sulfide gas coming from decaying materials in the Dominguez Channel. The board members say the local emergency declaration was prompted by a need to provide more resources to the affected communities and is not due to any new health concerns. As of last week, the city of Carson relocated more than 1,300 residents to hotels due to the smell. Carson has also declared its own state of emergency. LA County Public Works officials are looking into the possibility that chemicals from local refineries and other facilities contributed to the odor. They say a 4.3 magnitude earthquake near Carson may have disrupted the lines. Public Works employees have taken steps to drastically reduce the odor, but it's still quite a nuisance to many people in the region. The LA Department of Public Health has conducted door-to-door outreach to almost 9,000 Carson residents, including medically fragile individuals. And Public Works has coordinated with multiple experts and spent about $5.4 million so far on remediation and providing or reimbursing residents for air filters, air purifiers, and temporary relocation. Long Beach City College launched a unique program to help students who are experiencing homelessness. The Safe Parking Pilot Program allows enrolled students to sleep inside their vehicles overnight in a secure campus location. It's the only known program of its kind in our area at a community college. All students who are currently enrolled and experiencing homelessness can stay in the Pacific Coast campus parking structure from 10 p.m. to 7 a.m. 7 nights a week. The structure will be monitored by a security firm, and students will have access to restrooms, Wi-Fi, and showers. They must be independent with no spouses, partners, or children sleeping with them in the vehicle, but service and emotional support animals are allowed to stay with them if proper documentation is provided. Officials say LBCC has at least 70 students sleeping in cars each night, and they want to help keep their students safe and remove barriers that get in the way of their success. This program will run through June 30th of next year. Animal shelters in LA are nearing capacity and face an urgent need for pets to be adopted. Officials at the LA Animal Services say their center, which has 6 locations, can take about 1,700 animals, and they are right about there, with 1,000 of them being dogs. The increased number is partly due to pets getting lost or owners surrendering them because they are moving away. Adoption appointments are only needed for weekday visits. You can just drop by on the weekends. The LA Animal Services also has a foster program. You can learn more about adopting or fostering at laanimalservices.com. Well, bi-monthly, we share a Wellness Wednesday story to help you stay on top of this pandemic, both emotionally and physically. As COVID-19 lingers on this fall season, I met with a doctor in South Torrance to ask some commonly asked questions about the flu, keeping young children safe from COVID-19, and what to do to protect ourselves if we're taking a trip somewhere over the holidays. Exeter Urgent Care recently celebrated its grand opening at the Rolling Hills Plaza, and Dr. Corey Spurlock was more than happy to fill us in on what we need to know. First, let's talk about the fall season and the flu. Are we in flu season right now?
So not quite in flu season yet. I think, for the nationwide as well as for California, you're still in minimal flu activity, so less than 1% positivity rate. So probably in about 30 to 60 days, we'll be in flu season. And so with that being said, I think there's some things we can do to prepare now. Flu vaccines are available. The other thing I think is good self-care, right? Exercise, especially outdoor exercise, healthy amounts of sun, supplementation with vitamin C, zinc, turmeric, plenty of sleep, plenty of exercise, and good self-care. Again, taking care of your chronic medical conditions as well. I think all those things will get us prepped and ready for cold and flu season.
And what about the young kids and the babies who are not able to get vaccinated against COVID-19 right now? What can we do to keep them safe?
Yeah, so for, obviously for COVID, you're speaking to the COVID vaccine. Flu vaccines, again, we have, at Exeter, we have vaccines for kids for flu as young as 6 months. But I think some of those other things we just discussed regarding, adults. So really take care of kiddos of all ages, make sure their immune systems are bolstered, healthy, balanced diet, plenty of sleep, limit stress. I mean, this has been a stressful time for all of us, especially our kids with them having to navigate, the COVID protocols at school. So anything we can do to limit stress, outdoor creative play, hand washing for the older kids, right? Good again, hygiene techniques. And again, making sure that their chronic conditions, even if they're healthy, regular checkups with a pediatrician. If it's a kid who has asthma, making sure the asthma is well controlled and taken care of. So I think all those things, outside of the ability to have vaccinations are important to navigate.
Many of us are expecting to travel, especially as the holidays approach. Do you have any tips on how we can all stay safe and protected before, during, and after a trip?
I think traveling with and connecting with loved ones, family, and friends is probably more important now than ever, right? Especially what we've all been through over the past years. When you head out to travel, if you take medications such as diabetes medications, or again, if you're an asthmatic and have to use a rescue inhaler, make sure you take that stuff with you. For traveling by plane, obviously with TSA requirements, we're all going to be masked up and kind of distance as much as possible. I think limiting frequently touched surfaces, so contactless payment, right? Mobile boarding passes, any of those electronic things we can use. Keep hand sanitizer with you. And limit your interaction with sick people. I think if you're sick, probably stay home. See a medical professional. Probably not a good idea to travel. Otherwise, again, I think we can do it safely, and I think it's important.
Now, if people do feel sick, can they just walk right in here?
We have several large hospitals. We really want to limit the overflow, crowding in those hospitals, and so we've got some great options here at Exeter. Obviously, take walk-ins. We also have a new virtual line in an appointment system, so patients can walk up, scan a QR code, or get in line from home, and they can wait at home in their car, shopping. We'll send them a text message when it's their turn. Patients can also make an appointment for standard COVID testing online, and then we also have a telemedicine aspect to our practice in which patients can log in and see a healthcare professional by video or by phone from home or wherever, and if they need to come in for treatment, the doctor seeing them online will direct them to do so. So lots of great options.
Thank you so much, Dr. Spurlock.
Thanks for the opportunity. I appreciate it.
For more information on Exeter Urgent Care, you can visit exeterurgentcare.com. Well, before we go at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. The Volunteer Center South Bay Harbor Long Beach, a nonprofit based right here in Torrance, held a Trunk and Treat canned food drive last week to collect meals for vulnerable families. The center's Food for Kids program feeds thousands of school children every year. Community members came out in large numbers to give generously and volunteer their time in downtown Torrance.
The Volunteer Center is, it's one of those hallmark organizations of the city, one of the pillars of Torrance. So it's really important to support them. We had some canned vegetables, we brought some rice, we brought some, the kids wanted to throw some chips, some little chip bags in there, so we brought some chip bags. We got all kinds of little goodies.
Our organization is all about empathy, and we are all about how do you take that big heart of yours and put your empathy into action. And so when people are saying, what can I do, how can I help, especially when people are struggling so much right now, these types of events put that empathy into action, which we absolutely love and adore.
You can see more from this event in future episodes of Weekends in Torrance. You can see more from this event in future episodes of Weekends in Torrance. Now, if you have a great story, upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 Today. We'll see you back here tomorrow as Bella Shaw brings you the latest. Be safe, stay healthy, and thanks for tuning in.